Face masks have become a visible attempt to stop the spread of a hidden killer. Already compulsory in countries around the world, but as it stands, government here isn't recommending them for the general public, and some want a rethink.
What I'm lobbying the government's experts to do is to change their advice and the government to change their guidance. So in those circumstances where it's not possible to keep your social distance, think of public transport, think of when you're in a shop and you can't be 2 meters apart. For us to wear a non-medical facial covering to avoid the circumstances where you could be pre-symptomatic or asymptomatic and could inadvertently give somebody else the virus by your droplets passing from you onto them.
His call comes after research which looked at how South Korea had rapid community spread of the virus, which at the start tracked Italy. But after the government in South Korea required masks to be worn on top of other measures in late February, the death count started decreasing while Italy skyrocketed.
I think we need to distinguish very clearly between masks for healthcare workers, which have to be at a very high grade, and face coverings for members of the lay public, which can be homemade, and even if they are homemade, they can be extremely effective.
There is a worry from government ministers face coverings worn by the general public do more harm than good.
They could even be counterproductive for a number of different reasons, to do with people getting a false sense of security, not wanting to take away the real need for PPE, for that protective equipment from the front line and the NHS, therefore people using things like scarves and things which provide very little protection, or worse still, when people take them off, ending up being infected by having this thing on them.
But is that message understood by those already covering up here?
I don't know who has sneezed before me or coughed before me. So, and in a bus, in a shop.
Whether it does any good or not, it's probably more in my mind, but it makes me feel better.
Mixed evidence hasn't stopped people making their own at home. Scientist by day, seamstress by night, Karina's turned her hand to face masks.
So front is a colourful, lovely material, and the back that touches your face is a very delicate cotton. It's made in some sort of a pocket into which you can insert a professional filter.
The UK government says it is being guided by what scientists say. So far, evidence suggests they are not so much about protecting you, but others around you. Alan Jenkins, 5 News.